Hi, I'm Frank Diamond, the managing editor of Infection Control Today, where we're trying to give infection preventionists and other healthcare professionals the information they need to battle COVID-19 and the flu. The flu season is coming, and a lot of healthcare experts worry that flu on top of COVID could be a devastating blow to our healthcare system. One of those experts joins me now, Dr. Kevin Cavanaugh. Dr. Cavanaugh is a member of our editorial advisory board and is a frequent contributor to both our print and website publications. In fact, he posted an article just this week about just this subject, the flu and COVID. You should check it out. Dr. Cavanaugh, as always, nice to see you.
Well, thank you very much, Frank.
Now, you've been looking at the flu data from around the world, especially the data from the southern hemisphere of the Americas. Can you tell us what you've seen and how that might impact the flu season here in the United States?
Well, it is surprising. If you look at the southern hemisphere, the number of flu cases has just plummeted. You do not see massive pandemics sweeping many nations and continents. And this is somewhat surprising, but if you think about it, it's also very predictable. If you look at our data from the CDC, at the end of March, again, our rates of the flu plummeted. It's a very, very steep slope. And so one would ask, why did that happen? Well, it happened because of the use of masks, hand hygiene, and social distancing. These same public health initiatives and strategies, which are very effective on COVID-19, are even more effective with the flu. Well, why are they more effective? Because the flu is not nearly as infectious as COVID-19. The flu has an R0 on average of 1.3, where every one person that gets infected with the flu will infect 1.3 others. With COVID-19, the R0 is 5.7, where every one person infected with COVID-19 will infect 5.7 other individuals. And so when you have strategies of wearing masks, washing your hands, and social distancing, it may slow down the COVID-19 pandemic. It may even snuff it out over the long term if it's embraced by everyone. But when you look at the flu, which isn't as infectious, you would expect it to just annihilate that type of a pandemic and organism. And that's what we're seeing in the southern hemisphere. Now, that's, of course, is contingent that we follow this guidance, which, as you know, is anywhere but universally accepted by the American public. There is a huge debate going on right now. It's been politicized. People don't believe it's necessary, and this is not good. Reliance on a vaccine for the flu is problematic. As you know, Frank, it has a long history of sometimes being very effective, sometimes not being that effective. And when they make a vaccine for the flu, they try to judge what type of antigens will give you the best immunity. And each year it's a new vaccine. Well, they make that judgment from specimens which are submitted from the pandemic of the flu from South America and from the Southern Hemisphere. And so when you have very few cases and sporadic outbreaks in different countries which may or may not be the same strain, it's going to be problematic to get a very effective vaccine. And so our primary strategy, I feel, should be masking, hand hygiene, and social distancing, and using the flu vaccine to supplement this strategy. Now, they may well find a flu vaccine which is highly effective, but we shouldn't count on that because we know what is highly effective with the flu. That's wearing a mask, social distancing, and good hand hygiene. And so this is what we need to follow. Now, I should also add that when you get a flu vaccine, it does build up your immunity to all strains of the flu, and you get some cross-reactivity. So it is very good to get every year. And this is one of the reasons why with flu outbreaks, you will find the death and disability rates in the elderly to be much less than those of the young because they have had previous exposure to the flu antigen. So it is very good and very necessary to get the flu vaccine, but we shouldn't be counting on this to really ward off the utter devastation which can occur from getting flu plus COVID. We need to also do social distancing and good public health strategies.
Now, you're giving us very straight talk here, but you're also giving us some hopeful talk here too, because you're saying if the strategies are followed, social distancing, wearing a mask, hand washing, hand hygiene, if those strategies are followed, there's a chance that it could stop the flu in its tracks, even more so than stop COVID in its tracks. And our hospitals won't be all of a sudden in the fall filled with people with respiratory illnesses, and we don't know initially which one is which, right?
Well, and that's true. And you have to realize that I wouldn't say just a chance. I would say that all evidence and data points to that these strategies, if widely adopted, could just annihilate the outbreak of the flu in the United States. Unfortunately, they're not widely adopted. What then may happen is instead of annihilating the flu, we may suffer a devastation like you've never seen before, where flu plus COVID is infecting individuals at the same time, and that this may not be entirely prevented by a flu vaccine, which, as you know, can have questionable effectiveness, and this year may even be more problematic. So our primary strategy to prevent this from occurring should be implementing good public health strategies, wearing masks, hand hygiene, and social distancing, and using the flu vaccine to supplement those strategies.
Can someone get the flu and COVID-19 simultaneously? Has that been determined yet?
I believe you can, yes, you can get co-infections with COVID-19.
Where did you get that data from?
I would have to look that up for you, Frank, but that's been reported early on that that is possible. But it's unlikely because once you start to do public health strategies, the flu epidemic tends to die off.
So you're saying basically stick to the precautions that healthcare experts have been suggesting since this started. And are you suggesting a huge public health campaign, education campaign? But that's been going on. So I don't know how you change human nature this quickly. I mean, we sort of changed it with smoking, but that took decades.
Well, it needs to have consistent messaging from the top. Infection preventionists can help with that messaging. But if we don't do this, we can be easily overrun with these two pathogens at the same time. And that can be a disaster, or it will be a disaster. And so we need to do this. I don't know what we can do to get people to take this seriously. I still hear comparisons. Well, COVID-19 is just the flu. Well, it's not just the flu. COVID-19 outcompetes the flu in the Southern Hemisphere, and COVID-19 involves every organ system of the body, as the flu is primary respiratory. So COVID-19 is extremely more deadly and has lasting disability, which can occur fairly commonly in individuals. And so we need to take this seriously. And if you add flu plus COVID-19, you're just going to compound the problems and make a bad situation even worse.
Are our public health officials sounding the trumpet loud enough and long enough, you think? I mean, what you're saying, isn't it what the CDC is saying and has been saying?
Well, certainly, but it's not what a lot of our leaders are saying. And there is a lot of messaging trying to discredit science. And that's one of the things that is going on now, which is inhibiting our response to this pandemic. And getting active on social media and getting this message out is something which we need to do. Infection preventionists can be very, very much instrumental in getting out the correct message and counteracting the false messaging which you're hearing on both social media and also, unfortunately, from our elected officials. Schools are opening in many areas of this nation, and to me, this is a dangerous experiment. One college, I believe it was in North Carolina, opened and then had to close because of outbreaks. And so consistent messaging on the front end can prevent us from having to learn from experience. We should be learning from the experience of others.
I know you've written about this on our website and other places about herd immunity and how some will argue that, well, we have to create herd immunity by having enough people walking around who have had COVID and who have recovered. And that might be something that someone would say in response to what you're saying.
Well, Frank, herd immunity is a false narrative. This virus is far too infectious. You would have to have greater than 70 to 80% of the populace to become immune before herd immunity would kick in. And long-lasting immunity with this virus is in question. If you look at the recent data from San Quentin, 2/3 of the inmates have come down with COVID-19 and they are still getting infections. So there doesn't appear to be a big latent immunity in that population that is preventing infections, and herd immunity has not kicked in yet. If you look at population studies, the most recent is out of England. If you look at Sweden, if you look at Spain, if you look at the United States data from New York City or from Los Angeles, the amount of neutralizing antibodies that they're recording in the general population is surprisingly low. So herd immunity is a false narrative. It's a very simplistic way of looking at things, and there is nothing that I'm seeing in current research and data that is encouraging that this will take place.
Any final words for infection preventionists or anybody else that might be looking or watching, maybe people in the CDC or in the government?
Well, I think it is to get out there and to spread the word, do correct messaging, get on social media. Do not get intimidated by the internet trolls. There are many of them. Most of them have fake accounts that are completely blank. And personally, I agree with the study from Carnegie Mellon that a lot of these are being orchestrated by outside influences that are trying to undermine the United States. I think we really do need to get messaging out there to counteract this false narrative which is spreading around our populace, because I do not think we can depend upon the flu vaccine to ward off this disaster, which may well happen, getting flu and COVID-19 at the same time. What we need to do is adoption of basic public health strategies of wearing masks, washing your hands, and social distancing.
Dr. Kevin Cavanaugh, is always a fascinating discussion. Thank you for visiting us here on Infection Control Today, and thank you for being such a great contributor to our magazine.
Oh, no problem, Frank. Thank you.